assessment on you. I'm going to start with some questions. First, tell me your full name.
Joshua Parks.
Tell me today's date.
7/10/17.
And tell me where you are right now.
Parents' house.
Okay. We're going to do some simple addition. We're going to go up by 7. I will tell you when to stop.
7, 14, 21, 28, 35, 42, 49.
Okay. Good, thank you. Next, I'm going to look at your skin. Really just kind of check for anything that might be abnormal, like lesions, changes in color, open areas. Check your texture and your temperature and your turgor. Okay. Good. Turgor, I just do a little pinch. Good. Okay, good. Next, I'm going to look at your hair. Just kind of check anything that also might be abnormal. Look at the texture of your hair. Check for any uneven distribution of your hair follicles. Next, I'm going to look at your nails. Have you put your hands out for me? Same thing. I'm just kind of look at them first. Look for any abnormal colors. Check the texture of them. Any ridges. Okay. Okay, I'm going to just check your cap refill. And this side. Okay, good. I'm going to go to your toes. Same thing. Just kind of feel for any abnormal distribution. Look for abnormal color. Check for ridges. And then do cap refill. And then this side. Now back to your fingernails. I'm going to have you put 2 fingers together. I just want to make sure we don't have any clubbing. Okay, good. Next, I'm just going to look at your head and your neck. Inspect your eyebrows, your skin. Look for anything abnormal. Looks good. Your head's symmetric. Just press down here. That doesn't have any pain, right?
All right.
Okay, I'm going to have you open up your mouth for me. No pain.
No.
Okay. I'm going to check behind your ears. Okay, and while I'm doing that, I'm actually going to check your lymph nodes. Behind your ears, front of your ears, down your jawline, side of each neck. Okay, and then none of this hurts, right?
Right.
Good. I'm also going to check for sensation of your face. What I'm going to do is I'm going to do a cotton ball. I'll have you feel it first. Okay. Then with your eyes closed, I'm going to have you tell me when you feel the cotton ball.
Yes. 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 Yes.
Okay, good. Got a little cotton ball on you, sorry. And then I'm going to just check your facial expressions. I'm going to have you frown. I'm going to have you raise your eyebrows up and down. Close your eyes up. Open them. Close them again. And open them. Smile. Open your mouth. Okay, good. Now while I'm looking at your neck, I'm going to check for any abnormal masses. Make sure that's symmetric. Okay, I don't feel anything. I'm going to just check for your trachea. Okay, good. I'm actually going to have you have some water. However, I'm not going to have you swallow. I'm going to tell you when to swallow, okay?
Okay.
You can take your first sip. Okay, and then swallow. Okay, good. We're going to do the other side. You're going to do that again for me. Remember to hold the water and I'll tell you when to swallow. And swallow. Okay, good. I'm going to look at your ears. Inspect for anything that might be abnormal. If we're good on that side. And that side good. Let me just look in with my pin light. Okay, good. And good. I'm going to check your hearing. On this side, I'm going to whisper 3 words, and then on that side, another 3 words, okay? And you just repeat what I told you.
Okay.
1, 2, 3.
1, 2, 3.
Okay, and then on this side.
A, B,
then with my tuning fork, you're going to tell me if you have even hearing distribution after I hit it, okay?
Even.
Okay, and it sounds the same on both sides?
Yes.
Okay, good. Then on each side, I'm going to have you tell me when the vibrations stop.
Stopped.
Okay, and then on this side again.
Stopped.
Okay, and I'm going to go on this side. Same thing, okay?
Stopped. Stopped.
Okay, good. Okay, now I'm going to do your eyes. Just got to do a couple tests with those, okay?
Okay.
Just going to inspect them first, check for color, make sure they're even. Okay, thank you. The first test, I'm going to have you cover up one eye with one hand. I'm going to have you tell me the numbers on this line.
2843.
Okay, and then I'm going to have you cover the other eye and do the same thing.
2843.
Okay, and then while you have that eye closed and covered, I'm going to do check your peripheral vision. So I'm going to do the same on mine. So whenever you see my fingers, you tell me yes, okay?
Yes. 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 Yes.
Okay, and then let's do the other eye. Same thing, okay?
Yes. 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 Yes.
Okay. And then with that eye covered, I'm going to have you look straight ahead and just want to check your vision. Okay, good. And then let's do the other eye. Okay, good. With both eyes open, I'm going to have you just follow my fingers, okay? Okay, good. And then with my pin light, I'm going to just check your pupil responses. Just cover one. Okay, good, thank you. Let's do the other side. Okay, and good. I'm just gonna palpate around your eye and make sure you don't have any pain, okay?
Okay.
And no swelling, okay, good. I'm gonna look at your nose. Also do the same thing, make sure it's uniformed. I'm gonna palpate for any type of masses or asymmetry. Okay, none of that hurts, right?
Right.
Okay, good. Let me just look inside your nose with my pin light. Have you lift your head up for me? Okay, good. Now we're gonna do your mouth. Look at your lips, look at your mucosa, look at your teeth. You don't have tonsils, do you?
No, I do not.
Okay. Okay, then with my tongue depressor, I'm going to have you just open up for me. Have you stick your tongue out, lift it up. Okay, good. Get my pin light. I'm going to do kind of the same thing, but I'm going to have you open your mouth again. Stick your tongue down. Okay, I don't see any tonsils. No abnormal discolorization. Teeth and mouth look good. Stick your tongue up again. Okay. I'm going to have you keep your mouth open. Press down on your tongue and say, ah.
Ah.
Okay, and I'm going to have you stick your tongue out. Go up and down, left to right. Okay, good, thank you. Now I am going to go back to your neck because I did forget something. Okay, so I'm going to have you turn your neck side to side.
Okay.
Side to side, okay, good. I'm going to have you press against my hand. Good, and then do this side. Okay, and I'm going to have you shrug your shoulders. Okay, and then press against my shoulders. Okay, good. I'm going to have you take off your shirt because we're going to listen to your lungs and your chest. Just move this back a little bit. Okay, so I'm just going to inspect your skin, check to see how your breathing is, make sure you don't have any abnormal inhales and any exhales. Look for your AP diameter. Make sure you don't have any use of your retractory muscles. Looks good. Just do some slight palpation. Okay, and then no pain with this, right? Okay, good. And just some slight percussions, and then I'm gonna listen, okay? Then no pain with this, right?
No pain.
Okay, good. Okay, so each time I move the stethoscope, I just need you to take a nice deep breath for me. Nice deep breath. Okay, and then to this side. And then nice deep breath. Okay, I'm gonna have you turn around for me. Listen to your back lung, your posterior lung sounds. Same thing. Begin with inspecting your skin, making sure you don't have any abnormal breathing. Okay, you look good. Some slight palpation. Nothing should hurt, but if it does, let me know.
Okay.
Okay, nothing hurts, right?
Right.
Okay. Then some slight percussion. Okay, good. Just listen to you. Then each time again, every time I move it, just take a nice deep breath.
Okay.
Nice deep breath. Okay, I'm going to have you say 99 for me.
99.
And then again.
99.
Again.
99.
Okay. No pain?
No pain.
No pain?
No pain.
Okay, and then take a nice deep breath for me. Okay, good. I'm going to have you lay down for me and listen to your chest. Okay. While listening to the chest, you're going to do aortic, which is the second intercostal space, the right sternal border. You're going to do the pulmonic area, which is the second intercostal space in the left sternal border. You're going to do the Erb's point, which is the third intercostal space, left sternal border. And then tricuspid is the fourth intercostal space, left of the sternal border. And then the mitral is the fifth intercostal space to the mid-ventricular line. You're going to hear S1 at the mitral and tricuspid closure. And then you're going to hear S2 at the aortic and pulmonic closure. You will hear a systolic murmur at S1 and a diastolic murmur at S2. And before I listen to you, I'm just going to look at your chest, make sure there's no abnormal pulsations, make sure your chest is expanding good. Okay. Nothing abnormal. Let me listen to you. Okay, no murmurs. Just listen to the other side. Listen with the bell. I'm just going to do your pulses, okay? Good. Okay, good. And then just listen to those. And then filter the rest of your pulses. Okay. Good. All your pulses are even. Now I didn't hear any murmurs when I was listening to your chest, and if I did hear murmurs, I would have had you lean forward or in the left lateral position to get a better sound, okay? I'm going to move to your abdomen, just kind of looking to see if your peristalsis, look at your umbilicus, just really make sure I don't see any type of bulges. Okay, listen to you first. Then just some slight palpation, nothing should hurt, that does let me know.
Nothing hurts.
Okay, good. And just then just some deep palpation. Also, this should not hurt too, okay? Listen to your okay, good. I'm gonna try to palpate your liver. Take a nice deep breath in. Okay, good. And then I'm gonna palpate your kidneys. And none of this hurts, right?
Right.
Okay, good. I'm gonna have you put your shirt back on. We're gonna do muscular strength. Make sure we don't have any abnormal movements. Make sure no discolorization. Make sure there's no pain. I'll have you lay back and we'll do your hips. Okay, so we're gonna do one leg at a time. I'm gonna have you do this leg first, and you're going to go towards the wall and then towards me. Okay, good. Have you do that leg. Okay, good. Then with this leg, you're going to do knee to chest. And then back down, good, and then you do that one. Okay, and I'm gonna have you put each heel to the opposite knee. So you do that one first, and then kind of bend it back and forth. Okay, good. You do the other leg. No pain with it, with any movement, right?
Right.
Okay, there is, let me know. Have you put that leg down. I'm gonna have you bend your legs a little bit. And then kind of do the same thing, kind of rotate it back and forth. Okay, good. I'll have you do this leg again. Rotate back and forth. Okay, good. I'll have you put your legs straight again. So I'm also going to check your strength. So we'll kind of do it with the knee to the chest again. Okay, bend your knee. Okay, good. And we'll do this other leg. Bend your knee. Okay, good. I'm gonna have you sit, and we're gonna do your neck. Good. So with your neck, we're gonna do chin to chest. Okay, and then back. Okay, and then each ear to shoulder. Then rotate it. Okay, good. Bend back towards my hand. Good. And bend towards my hand. Okay, good. Now with your shoulders, arms out. Pull them up, across your head, and go down. Crisscross them. Okay, pull them back. kind of pull them up to touch your head like this. Okay, good. And then straighten out your arms. Then pull against my arms. Go up. Okay, good. Go down. Okay, good. I'm going to have you do your elbows now. So with your arms straight ahead, have you bend. Going to do fists and go up and then down. Okay, then let me check your strength. Do it again. Go up, then down. Okay. Then do the same thing but with your palms down. Go back up and down, and then straighten out your arms and go opposite. Go this way. Up and then down. Okay, no pain?
Nope.
Okay, good. We're going to put our hands straight out. We're going to just do our hands and wrist. So go up and down with your hands. Okay, push against my hands. Good, push against my hands. Okay, we're going to do fingers up and down. Up and down. Okay, have you squeeze my hands. Okay, good. We're going to do knees now. So with each knee, go up and down. Okay, press against my hand. Press against my hand. Good. And press against my hand. Good. Then this. Press against my. Okay. Now your feet go up and down. Go side to side. Then have them kind of have your toes touch. Kind of invert. There you go. Okay. Straighten out your feet. Press against my hands. Press against my hands. And then do your toes up and down. Okay, good. I'm going to have you stand. If you ever feel uncomfortable or unbalanced, just hold on to the bed. I'm going to have you turn sideways. Okay, so you're going to push each leg back and forward. Okay, how about you take a step up? Okay, back and forward with that other leg. Okay, good. I'm going to have you bend forward. Okay, touch your toes, then bend back. No pain, right?
No pain.
Okay, hands to your waist. I'm going to have you kind of stretch side to side. Good. I'm going to have you rotate. Okay, good. I'm going to have you sit down. Our last assessment is going to be neurologic. We're going to do a lot of sensations, coordinations, and your reflexes, okay? Okay, so we're going to check your sensation. So like your face, I'm going to do a cotton ball, and I'm going to have you tell me when you feel it. Let me show you again how it feels. And that's it, okay?
Okay.
Have you close your eyes for me. And tell me when you feel the cotton ball.
Yes. 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 Yes.
Okay, good. Next, we're going to do a sharp object and a dull object. I'm going to show you each side. That's dull, and this is sharp.
Okay.
Okay, I'm going to have you close your eyes for me. So,
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
okay, good. Now I'm also going to check your fingers and toes by your coordination. What that is we're actually going to do up and down. So this is going to be up, this is going to be down, okay?
Okay.
Same thing, I'm going to have you close your eyes for me.
Up. Down. Down. Up. Up. Down. Up. Down.
Okay, good. I'm going to put some objects in your hands and I want you to describe that item to me. Tell me what it is, okay? I'm going to have you put your palms up. Okay, close your hand for me and tell me what that is.
Key.
Okay, good. Do other hand. Close your hand. Tell me what that is.
Quarter.
Good. I am going to draw a number on your hand and I want you to guess the number that I'm drawing, okay? Same with your eyes closed.
7.
Okay, good. Do the other hand. we are going to check your coordination. So we're going to do nose to nose. Okay? Put your arms out and then touch your nose, finger to nose. Okay, do it with your eyes closed. Okay, good. Open your eyes. We're going to do nose to my finger, okay? Okay, close your eyes for me. Okay, good. Now we're going to pat our hands up and down on our lap, okay? Okay, close your eyes for me and do it. Okay, good. I'm going to have you check your sternum. I'm going to have you shrug your shoulders. Okay, good. I'm going to have you stand. Close your eyes for me. Okay, good. I'm going to have you sit back down. Check your reflexes. This is going to be with my reflex, okay? Bend your arm a little bit for me. This arm. And then I'm going to do your tricep. Good. Tricep on this arm. Okay, good. And then do your wrist. Good. And your wrist. Good. Do your knees. And this knee. Okay, do your feet. Then this foot. Okay, and I'm just going to brush the bottom of your feet. And this foot. Okay, good. We're going to see how well you walk. I'm going to have you stand. Have you walk that way. Just do a normal gait. Okay, good. I'm going to have you turn around. I'm going to have you do the back of your heel to your toe. Okay, good. Good. I'm going to have you turn around. Walk on your toes. Okay, turn around and walk on your heels. Okay, I think we got everything. Thank you.